Well, thank you so much, Chair Jackson. It's a pleasure to be back with you. I know last year we did a joint subcommittee hearing between the subcommittees 1 and 2 on the same population, elderly people, and what they were facing in terms of need for services. And I think the conversation is even more acute in the face of HR 1 being enacted. And I certainly appreciate your leadership on food access, nutrition access, and all of the other topics that are specific to the subcommittee number 2. I know in the health subcommittee, we've spent the last 2 months looking at the impact of HR 1. We really started talking about it, as did the chair here last year, in terms of thinking about what was going to be coming towards us and trying to prepare ourselves, and did everything we could in the budget to soften the blow. And this year, we're finding that the rubber really is going to hit the road in terms of the federal administration's attacks on our most vulnerable, and particularly on the senior population who are the most vulnerable. And Chair, you mentioned the 22% of Californians that are 65 and above. I know on the Central Coast, our numbers are closer to 30%. And in some parts of California, local numbers supersede statewide numbers. And I'll just add some figures to that. We know that the largest population of people falling into homelessness or being unhoused are age 50 and above. I was just with a group that came into my office yesterday that said they're seeing more and more families who are trying to qualify for various assistance, and added to the family is a senior who is struggling to meet basic needs and is struggling to access what they need. And we couple that with a age of the workforce that is relatively stagnant. We're not seeing changes in the age of the workforce, but we do have lower birth rates in California and across our nation. And so the population of people that's going to be coming into the workforce is shrinking, meaning we have less people that are going to be able to care for our elderly population at the same time that the federal government is cutting programs and cutting funds for those programs. So in my opinion, it's a very, very dire situation, and I'm pleased to be here as our subcommittees really cross over in many ways. So I want to thank you, Chair Jackson, for the opportunity to examine the governor's proposed changes to the in-home support services and to other issues that we're going to be talking about today. I know we have 4 different issues that we're going to talk about in our joint hearing, and then you get the honor of leading the rest of the items on the agenda after that. But really appreciate all of the public that is here. I know this is near and dear to many people, and I'm optimistic that we can make movement and that the governor will come back in the May revise with services and supports for our seniors.